Have you been feeling constantly tired, low on energy, or even experiencing a strange tingling sensation in your hands and feet? You might be surprised to learn that these symptoms could be caused by a deficiency in just one specific vitamin. And no, I'm not talking about the well-known B12. Let's dive deeper into what this could mean. Today we're focusing on vitamin B1, also known as thiamine, a key nutrient for our health that, surprisingly, many people don't get enough of. Despite its importance, this powerful vitamin is often overlooked, even though it plays a critical role in supporting your nervous system, brain, and heart. Curious to learn what can cause a B1 deficiency and all the symptoms it can trigger? Then stay tuned until the end to find out everything. But before we dive in, don't forget to like this video, subscribe to the channel, and hit the notification bell so you won't miss out on more valuable tips like this one. Have you ever felt a burning or tingling sensation in your feet? Or struggled with memory loss? Let's dive into it. Did you know that vitamin B1 was the first vitamin ever discovered back in 1910? But why is it so important for your body? Vitamin B1, also called thiamine, plays a crucial role in keeping us healthy. It helps convert the carbohydrates from food into energy, a process that's especially critical for the nervous system, which requires a lot of energy to function properly. Without vitamin B1, the body struggles to convert food into energy, which can leave us feeling more fatigued. But B1 is not just an energy source. It also protects the cells of the nervous system, keeping our nerves healthy and helping prevent issues like nerve pain and memory loss. In addition, thiamine is crucial for heart function. It ensures the heart has enough energy to pump blood throughout the body. When B1 is deficient, the heart can weaken, leading to symptoms like shortness of breath, swelling, and even more serious heart-related problems. Now you must be wondering, how can I become deficient in vitamin B1? Let's explore the main causes. Diet based on white rice. In the late 19th century, a Dutch scientist was investigating a strange disease called beriberi, which affected the people of Java. He discovered that chickens living near his laboratory also developed similar symptoms. After much research, he concluded that unpolished rice contained something that protected against this disease, calling it the anti-beriberi factor. In 1910, Japanese scientist Umataro Suzuki isolated thiamine, vitamin B1, as the key nutrient to prevent beriberi. The following year, a British scientist crystallized this substance from rice bran, naming it vitalamine, which later became known as vitamin B1. Therefore, consuming large amounts of white rice can be one of the main causes of B1 deficiency. Excessive alcohol consumption. Alcohol interferes with the absorption and increases the elimination of vitamin B1, causing the body to lose this vitamin quickly. People who consume alcohol frequently, including those who have a daily glass of wine, are at higher risk of B1 deficiency. Processed foods and a nutrient-poor diet. In addition to white rice, processed foods like white bread and refined pasta also lower B1 levels in the body. The processing of these foods removes thiamine, creating a cycle where the more you consume them, the more B1 your body loses. Excessive tea and coffee. Surprisingly, even tea and coffee can be enemies of vitamin B1. These beverages contain enzymes called thiaminases, which destroy vitamin B1 in the body. Those who consume large amounts of these drinks may be eliminating B1 faster than they realize. Raw fish and sulfites. Some foods such as raw fish and foods with sulfites, found in wine and dried fruits, can interfere with the absorption of B1. Few people know that these elements can be hidden obstacles to vitamin B1. Health conditions such as diabetes and the use of diuretics. People who use diuretics frequently may excrete excess B1 through urine. Additionally, those with diabetes or who undergo dialysis also eliminate vitamin B1 at a faster rate, increasing the need for replenishment. Increased B1 demands during specific times. During pregnancy, breastfeeding, intense physical activity, or periods of stress, the body requires more B1 to support the extra demands. If this need is not met, symptoms may begin to appear. People who have undergone intestinal surgeries like bariatric surgery, which alter the stomach or intestinal tract, can impair the body's ability to absorb vitamin B1, as it is primarily absorbed in the upper part of the small intestine. Additionally, these surgeries can reduce nutrient intake, contributing to the deficiency. Now, let's take a look at the most common symptoms of a vitamin B1, thiamine, deficiency. The initial signs can be subtle and easily overlooked: irritability, loss of appetite, and memory difficulties. Although they may seem like everyday issues, as the deficiency worsens, these symptoms become more severe and can deeply impact quality of life. Let's go. Main signs of vitamin B1 deficiency. Nerve pain. If you're experiencing sharp pain radiating down your legs or arms, this could be one of the first signs of B1 deficiency. This pain, known as neuropathy, occurs because the lack of this vitamin directly affects the nerves. Tremors, involuntary movements such as shaking hands or other parts of the body, can also be caused by B1 deficiency. Feelings of anxiety and despair. Vitamin B1 plays a crucial role in emotional regulation. If you're dealing with constant anxiety or a sense of impending doom, the lack of B1 may be exacerbating these feelings. Depression. Vitamin B1 plays a crucial role in mental health. A deficiency in this vitamin makes the brain more susceptible to stress and lack of energy, factors that can contribute to symptoms of depression. This happens because a lack of B1 can increase oxidative stress and inflammation in the nervous system, making it harder to produce and balance neurotransmitters like serotonin and dopamine, which are responsible for mood regulation. When this balance is disrupted, symptoms such as anxiety, a sense of hopelessness, and pessimism are common. Lack of focus and concentration. If you're struggling to complete tasks or maintain focus, a B1 deficiency could be the cause. Racing mind and insomnia. If you feel restless at night and have trouble falling asleep, this could be a sign that you're lacking B1. Vitamin B1 helps calm the brain, promoting more restful sleep. Restless leg syndrome and lactic acid buildup. Waking up with the urge to move or shake your legs could indicate a B1 deficiency. This vitamin is also involved in eliminating lactic acid from the body, and its deficiency can lead to the accumulation of this substance, contributing to restless leg syndrome. Autonomic nervous system issues. Vitamin B1 is essential for the proper functioning of the autonomic nervous system, which controls automatic body functions such as digestion and heart rate. A deficiency can result in slow digestion, acid reflux, and other related disorders. Burning sensation in feet and hands. If you feel a burning or numbness in your extremities like in your feet and hands, it may be a sign that your nerves are being affected. A lack of B1 damages the peripheral nerves, causing these uncomfortable symptoms. Dizziness and vision problems. A deficiency in vitamin B1 can damage the optic nerve, leading to vision disturbances and dizziness. These symptoms are more common in individuals with diabetes. And it's important to highlight, if a B1 deficiency is not treated in time, the symptoms can significantly worsen, further affecting your quality of life. Now you might be wondering, how can we find out if we have a B1 deficiency? Let's explore the diagnostic methods. Blood tests. One of the most reliable tests is the erythrocyte transcatase activation test. It measures the activity of thiamine in the blood, helping to accurately identify deficiencies. Thiamine analysis in blood or serum. Another common test, performed through chromatography, measures the exact levels of vitamin B1 in the body, assisting in the diagnosis. Clinical symptoms. In some cases, signs like difficulty with movement and mental confusion can be important indicators that lead doctors to consider a possible B1 deficiency. These are the main ways to detect if the body is lacking this essential vitamin. How to treat vitamin B1 deficiency. Immediate treatment. In severe cases such as heart failure or neurological problems, intravenous administration of thiamine 500 mg per day is required for 1 week. In emergencies like heart failure, this treatment is started immediately. Long-term treatment. For individuals already showing symptoms, treatment usually involves daily doses of thiamine, ranging from 10 to 100 milligrams, until the deficiency symptoms subside. How to prevent B1 deficiency. Which foods are recommended? Adopt a balanced diet. Include foods rich in thiamine such as pork, beef, whole grains like brown rice and oats, legumes, beans, lentils, seeds, nuts, and green vegetables. Brewer's yeast is also an excellent natural source of B1. These foods help maintain adequate levels of this essential vitamin in the body. Avoid excess tea and coffee. Limit the intake of these beverages throughout the day to prevent them from interfering with the absorption of vitamin B1. Moderate alcohol consumption. If possible, reduce or eliminate alcohol from your diet, as it hinders the absorption of B1. Special attention in specific cases. Individuals with diabetes, pregnant women, or those who are breastfeeding should pay extra attention to consuming foods rich in B1. As you can see, vitamin B1 deficiency is a serious condition that can significantly impact quality of life. Did you already know this? If you enjoyed the video, like and share it to receive more health tips. See you next time.